So Jane, could you tell us a little bit about your role, what that involves being an infant feeding key worker?
Okay, so in our larger team, I offer support to the health visitors and other community nursery nurses when maybe they've had a little bit of an issue with one of the mums, where the feeding isn't maybe going quite so well. But also I go and visit or do telephone contacts with parents around sort of really looking at the feeding and how that's going. So at the start of that visit, I get a good history from mum, just about how things are going and where things haven't been going quite so well. And then I would offer to actually have a look at a feed. And we really do go back to the basics with it, and we really start looking at the positioning and the attachment. And often it's just a few little tweaks with that area, and that can have a massive impact on how the feeding is going. So, our basic things are about, baby being close to mum, starting in the nose to nipple, able to tilt baby's head back, and able to then come forward really quickly, to the breast, so that they get a good mouthful of breast, and then, start the feeds.
In your role, what would you say? Would you say that the health visitor and the nursery nurse is the first port of call, and then you're the additional support that comes in?
Absolutely, it's part of the first sort of visits with the health visitor. They will be looking at feeding and how that's going. They might come back and have a conversation with me, or they might just ask if I can possibly pop out and have a look at that feed.
So is there anything else, Jane, that you'd want to say that would be helpful for anyone to hear?
If you're struggling, ask, because if you don't ask, we don't know. And if you're thinking, actually, this doesn't feel right, this feels a bit uncomfortable, I'm getting sore, if we can get in early before things get too bad, then that's much better than hanging on and waiting and think, somebody's coming in 3 days' time. But in 3 days' time, things are going to have changed, and we want to get in earlier rather than later.